Hello, it's Sohail, and welcome to another drug demystified video where we take common drugs, demystify them to empower you to understand and manage them better. In this video, we're talking about amitriptyline. Amitriptyline is a medication used for things like depression, anxiety, and certain types of pain, including nerve pain. It belongs to the group of medication known as the tricyclic antidepressants, but don't let that put you off. If you're taking it for nerve pain, it's quite commonly given for pain. Well, amitriptyline works by rebalancing important chemicals in your brain called serotonin and noradrenaline, and this balance can help with things like your mood and also for certain types of pain. The dose of amitriptyline actually varies based on you and what you're taking the amitriptyline for. So in pain, it's quite common to see 10 milligrams of amitriptyline given as a starting dose to be taken a day. And then based on your symptoms and how well it's working, the amitriptyline dose can be adjusted to 75 milligrams a day, slowly over time. Amitriptyline should be taken around bedtime, and that's to minimize drowsiness. You have to be quite patient with the drug. It can take 1 to 2 weeks before you start to feel a bit better, and its full effects may not be seen for a month and a half. So what to do if you missed a dose of amitriptyline? Well, take it as soon as you remember. Obviously, if it's the next morning, then it's probably worthwhile to omit the amitriptyline. You don't want to be taking it first in the morning and then going around driving, as it will make you feel drowsy. So in that case, omit it. Take the next dose as usual, nighttime again, and never take a double dose based on the one that you just missed. In terms of side effects of amitriptyline, some common ones could be dizziness, drowsiness, headaches, dry mouth, constipation, difficulty urinating. If you're having any of these, then it's worth obviously having a look at Sohalogy's website, where there is actually a web page about common side effects and how to manage them. If you're experiencing drowsiness the next day, then you could take amitriptyline slightly early on in the day, so in the late evening time. And if you are struggling with side effects in general, it's worth persevering with amitriptyline because it can take a few days for the body to adjust. If you're finding that the side effects are severe, they're persistent, or that they're bothering you, then naturally speak to your GP clinician, NHS 111, or your local pharmacy. Inform your clinician about the medication you're taking, including any herbal or over-the-counter supplements and remedies. And then they can obviously help you and discuss interactions with yourself. In terms of things that you could find over-the-counter, something like St. John's wort is worth avoiding, as that can interact with amitriptyline. In terms of special warnings or things to look out for, amitriptyline is a drug that can make you feel drowsy. If you're taking alcohol on top of this, you might feel more drowsy. So you might be better to see how you get on with amitriptyline before you're drinking. And when you are drinking, just bear in mind the knock-on effect that will have in terms of drowsiness. Amitriptyline can also increase the sensitivity of the skin to the sun, so that's something to bear in mind. In terms of stopping amitriptyline, if you do wish to stop it, discuss that with your GP. Never decide to stop it all of a sudden, as that can lead to withdrawal effects. Monitoring your progress, so that could be follow-ups with your GP clinician where they get you in, they see how you're getting on with the amitriptyline, whether it's helping the symptoms and whether it's worth increasing it or not. So make sure you obviously attend any follow-ups. Where to find more information and who to contact if you're having any issues? Well, further information can be found on the patient information leaflet in the box that came with amitriptyline, and also on the NHS website. If you're experiencing any unusual symptoms or have any questions about amitriptyline, please speak to your GP clinician, your local pharmacy, and also NHS 111. Right, so that brings us to an end of this video. Thank you very much for watching. As always, if you could please like and share the video, if you can subscribe to my channel and leave me a comment below, and please do not forget to visit the website sohalogy.com. Thank you.